Hello friends, I hope you all are doing well, and I hope you liked my last video about leaf gauge. I specifically recorded this video and posted it because not everyone has seen and not everyone knows how to record centric jaw relation with a leaf gauge, although this is not the only technique and this is not the widely used technique we use for recording centric jaw relation. I was about to start a case on full mouth rehab and I thought why not just give a very small talk about Facebow and articulators to all my general dentist friends who have very less idea about Facebow and articulator. To begin with, a Facebow and articulator is always going to come in a pair. If you buy a Hanau Facebow, you will have a Hanau articulator with it. If you buy a Ivoclar or a Stratos 300 or a 200 or a 100 articulator, you're going to have a UTS transfer and you cannot interchange the both. So in a nutshell, a Facebow and articulator comes in pair. Now, why do you want to use a Facebow and an articulator? Let me not go into the technical details. The whole objective of recording a semi-adjustable articulator is to record your temporomandibular joint movements or to record your hinge axis, transfer it onto the articulator and make teeth on an articulator in such a manner that it is going to simulate or copy the movements of the natural TMJ onto the articulator. So which articulator and which Facebow to buy? That's $1 million question. Well, my answer is buy anything which your lab is comfortable with. If your lab is using a Stratos articulator or if your lab has a Stratos articulator, you can only invest in a Stratos Facebow. If they are using Dana Mark 320 articulator or a Artex from Aman Gerbach articulator, you can buy that specific Facebow. There is no need to invest in an articulator per se separately. Now, what do? First, you are going to record a Facebow. Let's say I have a Facebow of this company. So you're going to record a Facebow of the patient. You're going to record the hinge axis, that is the center of rotation of one condyle to the center of rotation of another condyle. And we want this Facebow record. It has nothing got to do with mandible, your Facebow record. It is only going to help you in orienting your maxillary cast onto the opening axis of the articulator. Something like this, if this is an articulator, so this is my opening axis of the articulator along which the, the movements of the TMJ are going to take place. So when I'm going to mount the maxillary cast, I am going to mount the maxillary cast according to the Facebow, what we have recorded in the patient, and then transfer it onto this articulator. So what you guys can do is, you can record your Facebow record of the patient, and then what you can do is, if you have the articulator yourself, you can yourself transfer the record to the articulator and then send the articulator to the lab. Or what you can do is, you can just send this assembly. This is something called as a 3D joint. Different articulators have a different 3D joint. So what you can do is, you can also send only this 3D joint with the mounting plate or without the mounting plate to the laboratory, and the laboratory fellow with the help of this 3D joint is going to mount the maxillary cast onto the articulator. And after you have deprogrammed the patient and you have made a centric relation bite record, you are going to mount the mandibular cast onto that particular articulator where the maxillary cast is already mounted according to the Facebow. So now you have a maxillary cast mounted which has a relationship to the opening axis of the articulator, and secondly you have your mandibular cast mounted onto this cast with a centric relation bite record. So this is the main use of a Facebow and articulator, and of course then you go ahead with programming of the articulator so that you can simulate the movements as close as possible to the temporomandibular joint onto your articulator, and then you can proceed. Which cases you can use? Well, you can use your articulator for any kind of a complex case, maybe some long span restorations or your cast partial dentures, or probably where you're doing only upper and lower anteriors and you want to develop your anterior guidance, or complex completely full mouth rehabilitation cases, implants. So there is wide range of indications for using your Facebow and Articulators. Second, what I would like to say, a very important indication is, especially when you are doing your anterior cases and you want to correct your anterior cant. Many patients would have an anterior cant which is not parallel to the interpupillary axis, the anterior plane, and even though you know how beautiful you do your restorative dentistry, if the plane is not corrected, it's not going to look good onto the patient's face. The face is not going to complement the beautiful teeth what you're going to make. So with a Facebow, you can be able to correct the anterior plane and correct the cant which is existing in the patient and get it straight, and then you can have a nice, perfect, complete, beautiful smile. So there is a lot to speak about these Facebow and Articulators, but I would like to say that this is something which is mandatory and which everyone should start using it. Thank you.